All right, so after left atrium, what comes next? The chamber, great vessel, or valve? Valve. What valve? The bicuspid? Tricuspid or bicuspid? Bicuspid. And is there another name for it? Mitral, right? So it'll be the bicuspid, and you just would have to write just one or the other, or mitral valve. Okay? After that, I got chamber, great vessel, or valve. Chamber, what chamber?
Left ventricle.
Yeah, left ventricle. Okay, I always say, be careful, last few letters. I usually get a few people put in C-A-L, right? And that's wrong. That's not good. After left ventricle, chamber, great vessel, or valve? Valve. Aortic valve. Then you got chamber, great vessel, or valve? Vessel. What great vessel? Aortic. And then that leads to a bunch of different arteries, which we'll get to in a couple weeks. You'll get to learn all those arteries, but we're just dealing with basically just the heart itself. So eventually, after the aorta gives blood supply to certain parts of the body, let's say to the lower extremities, now deoxygenated blood is going to leave the lower extremities, like the legs, and go back to the heart by way of what? Inferior vena cava. Right. So it's below the diaphragm. Then you've got the chamber, great vessel, or valve. Chamber, what chamber? Right atrium. Chamber, great vessel, or valve. What valve? Tricuspid. What's the other word for tricuspid? There's no one. That's a trick question. All right? After that, chamber, great vessel, or valve. Chamber, what chamber? Right ventricle. Then you got chamber, great vessel, or valve. What valve? Pulmonary valve, or pulmonic valve, same thing. Then you got chamber, great vessel, or valve. Great vessel, which would be, yeah, this is the one where I said you could either call it the pulmonary, yeah, you call it the pulmonary trunk, or you could say the pulmonary artery. Okay? Then that goes to our lungs, and then from the lungs to the left atrium, you got what? Chamber, great vessel, or valve? Great vessel, which is, yeah, pulmonary veins, right? Okay. Pretty easy, right? Like I said in the video, you need to know this, not just like ABCs is the kindergarten. You need to know this. If I said to you the pressure in the left ventricle is higher than the pressure in the left atrium, which valve is going to close? The bicuspid. You see what I'm saying? If you don't know the blood flow through the heart, forget about answering those questions properly. All right? These are the basics. If you don't know letters, there's no way you're going to actually write words. All right? You're going to need to know this quite often. Even when we do the trace question, you know, a few weeks when you do your first practical, if I'm going to say go from your blood vessels, from your right wrist to your left ankle, you're going to do all the veins to your heart, the whole heart, and then all the veins, or I'm sorry, all the arteries going to your left ankle. This will always be on there. And it's just the basics of this. Okay? Questions about that? You did pretty well. Most students do very well on this. I get a lot of 20s out of 20s.
If you spell something wrong, that only has to apply on.
Well, a half of what it's worth. So each one of this, like say there's each one of them is 10, there's 10 things you would fill in. So, but it's 20 points, so each one is worth 2 points. So you lose half of a point, or half of 2 points, which would be 1 point. I always do spelling where it's going to be half of what it would normally be worth. Okay? No one fails because of spelling. At least I've never encountered it in my 8 years. They fail because of other reasons. It's just, you know, because of the spelling, it just makes the failure get worse. But believe me, I usually see people who usually get, let's say, they tell me they're like A, B students and they're bad spellers. Believe me, after the second exam, they're very good spellers. They don't usually, you know, they catch on. I mean, I had it when I was in college, and I did anatomy. There's a muscle called levator levi superioris acini. All right? And I spelled one thing wrong. They took the whole thing off. That's pretty rough. You know, I just wasted some lead on that paper over there, you know. So, like I said to you on day one, I mean, it's important to get the spelling. It has to be there. But I'm not going to take off the whole thing if you have the idea. Unless, of course, it's a word that looks totally different. You put afferent and the answer is efferent, and you change this to one letter. Well, yes. But if it's something like this, or if you have something, I have in A&P1, students would say nucleus versus nucleolus. And if it looks like either or, I mean, you know what I'm saying? But if you're going to put something like, you know, aortic, and you have you left off the O, I'm going to take half off. Okay? So don't worry so much about the spelling. I would usually do that on a syllabus day, and I had one person in 8 years that I taught where she stood up and just walked out. Where are you going? She goes, well, I'm a bad speller, and you know, I'm going to fail the course. I'm like, get back. You know. Because then don't go into the medical field if you're that bad of a speller that you can't do anything, because you're going to kill people. You know, the decimal point in the wrong place, it's going to kill a diabetic, right? So don't worry so much about the spelling. You just have to get with it. It's more the content that people have more issues with. Okay? All right, questions about this? All right. Here's a little mnemonic to help you. I don't know if it was in this, someplace in my recordings. You have lab rat. So we have the left atrium has the bicuspid valve. The right atrium has the tricuspid valve. That helps you. Okay? There's probably other mnemonics, but whatever works best. Most students get mixed up between the bi and the tricuspid. Then we throw in the mitral. I'm like, oh god. All right, so let's do this. I'm going to kind of go. A lot of this I'm going to go pretty rapidly because it was a lot of stuff that you did before. If you're lost in stuff, please raise your hand. Anyway, all right. So cardiology, and like I said, a lot of stuff is on the videos that you're going to see in A02 and A03. All right. Basically, it's a little giant pump. Right? It's about the size of your fist. I kind of explained to you earlier with endocrinology, Andre the Giant, that massive guy with gigantism and acromegaly, his fist, well, when he holds a can of beer, you can't even see the can of beer. So you can imagine, when he makes a fist, you can imagine the size of his heart too. Okay? It's going to pump blood through about 50,000 miles of blood vessels. The heart does stop for about a quarter of a second. It has to. Every time it beats, in between the beats, it has to stop. The reason why is because it's going to be filling up with blood. You can't be blowing a balloon, and that balloon's getting big, and someone's compressing on it. You're not going to get any air in the balloon if someone's pressing on it. Same way here. The heart's got to rest so that it can fill up with blood. And it rests for about a quarter of a second. Okay? The heart functions, generate blood pressure. We'll talk all about that later. Routes blood. We have valves in there. And valves ensure one-way blood flow. So just showing you what's happening here is that if this is the left atrium and down here is the left ventricle, if this is the valve in between them, which is what? Between the left atrium and the left ventricle. Bicuspid or mitral valve. Good. So you have a valve there, and what the valve is going to do, it's going to open, allow the blood to go there. If the pressure is going to get higher in the left ventricle than the left atrium, it'll close. It'll go pop, pop. Okay? So valves, so it doesn't go backwards. All right? So it just opens like this and stops there. It prevents blood from going backwards. So whenever you see valves, it's telling you it's ensuring one-way blood flow. You're going to learn that we have valves in our veins to help the blood make sure it goes up to the heart and doesn't go backwards. Okay? All right. So we have arteries and veins, right? We talked about that in the video. Arteries always carry blood away from the heart. Veins always carry blood to the heart. In general, arteries will always carry oxygenated blood, and veins will always carry deoxygenated blood. The two exceptions is the pulmonary system and the fetal circulation. The pulmonary system, the pulmonary arteries carry deoxygenated blood, and the pulmonary veins carry oxygenated blood. But the veins, the pulmonary veins, are going to the heart. That's what they're defined by, which way the blood is going. In the fetal circulation, we have umbilical arteries and veins, and we'll get into those later, but in that case, the umbilical artery is going to carry deoxygenated blood, and the umbilical veins carry oxygenated blood. Okay? So, just to reiterate, the right heart is going to get deoxygenated blood from this girl running. So veins are going to bring it to the right heart. It's going to receive deoxygenated blood, and it's going to pump it to the lungs. The lungs is where gas exchange takes place. Carbon dioxide comes off, oxygen comes on. And then the lungs will pump it, or not pump it, but it'll push it into the left heart, and it's going to receive oxygenated blood. So that has to be a vein because it's going to the heart. But it's carrying oxygenated in that, so we call it the pulmonary veins. Then the left heart is going to pump the blood into the aorta throughout the whole body, and that cycle repeats, and repeats, and repeats. Okay? Pretty basic, simplified version. Okay? Now, the anatomical heart. All right, the center of the chest, it's not on the left side. It leans to the left, like where the point is, or the apex of the heart, the bottom part of the heart, it leans to the left. It's going to be above the diaphragm. It's going to be anterior to the vertebral column and posterior to the sternum. Kind of sits in that area right there. Okay? Now, we have this area called the mediastinum. Okay? Something you should have learned from A&P. Chapter 1, actually, in your A&P book. The mediastinum is an area of space that's found in between the lungs. Now, that area of space is obviously going to carry the heart, but there's other things in there also. The trachea is in there. You're going to have the aorta as it comes down. That's also going to be the mediastinum. There's a lot of things that are there. So the mediastinum behind the sternum plate is going to be this. If we remove the sternum and the rib cage, that's the mediastinal area. It has the heart. You'll have phrenic nerves that go down to the diaphragm. Even if I remove the heart, all of that is also found in the mediastinum. So if you're in radiography and someone says, well, we got to rule out a mediastinal mass, you're not just thinking heart, you're thinking of a mass that could be coming from the trachea, or it could be coming from the bronchus, or it could be coming from the esophagus. So that's what the mediastinum is. It's an area of space. Basically, it's the thoracic cavity where the lungs are not occupying. Okay? And this is a side view of the mediastinal space. I won't ask you about this, but that's what I'm saying, is a mediastinal mass can happen from any organ that's found in the mediastinum. And that's going to help people for, the PA or nurse practitioner or radiography. That's what it's dealing with. Now the heart is actually inside of a sac called a pericardium. It's a double-walled sac around the heart. And it's composed of a fibrous component and a serous component. Okay? The fibrous, which is as the name implies. There's fibrous connective tissue there. That's the superficial area. Now, the serous pericardium is composed of 2 layers. And you've heard of these layers in A&P 1, Chapter 1. The parietal layer and the visceral layer. The visceral layer is also known, when we're dealing with the heart, is the epicardium. That's the part that's going to be on the heart itself. Whereas the parietal layer is going to be around the cavity. The best way I could actually show you what this is, to express that the visceral and parietal layers are connected to each other, is looking at a simplified picture using this balloon. Let's take, for instance, the heart is the fist. The balloon is going to be your pericardium, the serous pericardium. There's going to be a layer that's going to be on the heart itself. That's the visceral layer. And then there's going to be an area over here, and that's the parietal layer. There is a potential space between the visceral and parietal layer. In this picture with the balloon, it's exaggerated. You won't see this space over there. In actuality, the visceral layer and the parietal layer are touching each other. But it's exaggerated so you can visualize it a little bit better. When it's touching each other, if you put your fist in this, and it's all latex, these balloons, you put your fist in there, you try to open up your fist, you won't be able to do it. Why? Because the latex over here, the visceral layer, and the latex over here are creating friction. It's not going to be able to slide over each other. Not a good thing. But we need it to open up. We need that heart to fill up with blood, so this fist is going to open up. But if there's nothing here and it's just touching each other, you're not going to be able to do that. But what if I put a few drops of water in between there? Now, when that heart opens, it can slide against each other, decreasing the friction. Does that make sense? Okay? That's what we have there. That's why it's a serous. Serous means watery. Serous membranes. And there is a few drops. You shouldn't see a space in there. But it allows the heart to expand so that it can fill with blood. Again, this is still a little exaggerated. You shouldn't see a space in between there. But you can actually visualize it a little bit better. And it's a running theme, the visceral and parietal layers. You'll see it around the lungs also, to allow the lungs to expand with air. Okay? You'll see the visceral and parietal layers and many other organs throughout your body. So this is a running theme you really have to get under your belt. So the pericardium functions, it protects and anchors the heart, so it's not free-floating over there. We need something that's, you don't want the heart to keep on filling, and then the heart's going to explode. So the pericardium is going to limit how much that heart can actually fill. Okay? So if the linings of this pericardium get inflamed, we have something called pericarditis, an inflammation that can happen on there, an infection. And what happens is the lining of those 2 layers get thick. And if they get thick, you're not going to be able to have that heart expand because there's something pressing against the heart because of how thick that is. And this can cause severe pain. We see this also in something called pericardial tamponade. What if the heart gets punctured for some reason? And some of the blood that's in the heart is now going to go into this cavity, so that the space in between the visceral and parietal layers are going to fill up with blood. Then that blood that's going to be occupying that space is going to press on the heart, and the heart can't expand. Does that make sense? Can you visualize that? We call that pericardial tamponade. So what do we have to do? Well, we've got to figure out what the whole reason is, but in the meantime, we're going to cut a little window, maybe the size of a dime, cut a little window out of the pericardial sac to get all that blood in the pericardial space to be removed. So now that the heart can actually beat and find out where the source is of filling up all that blood. Does that make sense? You call it a pericardial window. You make that little hole there. So the heart wall has 3 layers. The epicardium, which is the visceral layer. The myocardium, which is the much thicker muscular layer that's going to contract the heart. And then we have inside the cavities of the heart, it's lined with another type of endothelial tissue, and we call that the endocardium. Now, and I'll show you a picture of that in a second. The way the endocardium is, when you look inside the chamber, when we look at these models and look at these dissected hearts, when you look inside the chambers, the lining of the chambers are not smooth. They have all these ridges, and the best way I can explain it is looking at Freddy Krueger from Nightmare on Elm Street. A burnt kind of look. That burnt kind of look has a couple names. If we find that in, and we do, when you find that in the atria, we call it musculi pectinati. When we see that in the ventricles, we call it the trabeculae carni. Okay? So here's a cross or a section of the heart. And we blow it up, and this is the pericardium. So here's the parietal layer. It's continuous with the visceral layer. That there, this visceral layer, is the epicardium. Does that make sense? This here in the middle is going to be a pericardial cavity. That should be touching the parietal layer. But in a drawing, it's just so you can visualize it better, they put the space there. Then you have a very thick muscular layer, that's the myocardium. And then the inner layer of the cavity, we call that the endocardium. You can already see some of the Freddy Krueger look that's in the cavity. All right, just showing you again, here's the epicardium over here, the yellow area, here's the myocardium, and this blue area is going to be the endocardium. And that's what it looks like. Freddy Krueger. That burnt look on here. You'll see with the models and dissected parts. Okay, so the way the heart is, you've already seen it, there's the right heart and the left heart. The reason why it's really 2 pumps is because in embryology, it started off as 2 tubes. And then they fuse together, and then in a twist and turn, and it goes into a heart that we all know and love. Okay? The right heart receives deoxygenated blood, the left heart receives oxygenated blood. The left heart wall, the myocardium, is 4 times thicker than the wall on the right side. And it makes sense. When the left heart pumps its blood, the left ventricle, where does it send it to? All over the body. So it's got to give a nice, huge muscular contraction. So we expect that the muscle there is going to be thick. The right ventricle is going to pump its blood where? To the lungs. And how far is the lungs from the heart? Very close. So it's right there. So the right ventricular wall is going to be much thinner than the left ventricular wall. Does that make sense? Right? This again, and it's a running theme that I always talk about, that physiology reflects anatomy. That function reflects structure. It makes sense why the right ventricle is much thinner than the wall of the left ventricle. Okay? So this is just showing you 2 tubes that are fused together, twist and turn, and it turns into the heart that we all know and love. Okay? So there's our picture. And like I said, we have two parts. Well, the right heart and the left heart have similar structures and similar cavities. So the right heart has the right heart has a right atrium and a right ventricle. The left side has the right atrium and the left atrium and the left ventricle. On the right heart, we have two valves, as you've seen, right? The tricuspid valve and the pulmonic or pulmonary valve. The left side has two valves also, but those are the bicuspid, also known as the mitral valve, and also the aortic valve that's there. So just all this for the video, really to reiterate, and you guys all know this, but let me just go through it again. The right atrium is going to receive deoxygenated blood. If it's coming from below the diaphragm, things like the liver, the stomach, the legs, the genital area, it's going to go by way of the inferior vena cava. Anything that's going to be deoxygenated blood from above the diaphragm is going to be from the superior vena cava. All right? So things like your chest wall, your arms, your head, that's going to go into the superior vena cava. Doesn't matter, it's carrying the same type of blood just from two different places. The right atrium is then going to receive that blood, deoxygenated blood, and push it into the right ventricle, but has to pass through the tricuspid valve. The right ventricle is then going to pump its blood to the lungs, but it has to pass through the pulmonary valve or pulmonic valve, and then the pulmonary arteries. So like I said, you have this pulmonary trunk, and then that leads to the pulmonary arteries. So you have one lung here and one lung over here, right? That'll pump its oxygenated blood now to the left atrium, but it has to go through the pulmonary veins going to the heart. The left atrium pumps its oxygenated blood into the left ventricle, but it passes through another valve, the mitral or bicuspid valve. And then the left ventricle is going to pump it to the aorta, but it has to pass through another valve, the aortic valve. And that cycle repeats and repeats and repeats. Okay? Questions on that? You know about the major great vessels, superior and inferior vena cava, carrying deoxygenated blood. We also have the pulmonary veins also, that are going to carry oxygenated blood from the lungs to the left atrium. So the atria are the receiving chambers. The ventricles are the discharging chambers. Okay? The ascending aorta, or just the aorta for our time being, goes into something called the aortic arch. And there's three branches off of here. We'll talk about those later. Okay? So let me just show you on here, and then when you come back for the lab, we'll be dissecting. I got a little bit more lecturing, and then we'll do the dissection of the models. So let me just show you again. This is the anterior view of the heart. This is going to be your right atrium. Here's the left atrium. This is the right ventricle. This is the left ventricle. Here's the superior vena cava. Here's the inferior vena cava. Both of these will go into the right atrium. Now you can't really visualize the inferior vena cava going in because you have to look at the posterior side. We'll show you that when you come back. When blood gets to the right ventricle, it pumps it into the pulmonary trunk. The pulmonary trunk has two branches. One goes this way, and one goes that way. Pulmonary trunk leads to the two pulmonary arteries, like what I drew for you up here. Goes to the lungs. Now from the lungs, it's going to carry oxygenated blood, and there's going to be 4 pulmonary veins. 2 from one lung and 2 from the other lung. And they lead into the left atrium. There's 2 pulmonary veins, and here's 2 here. You can't see it from this view, but this is going all the way to the left atrium. You just can't see it in this view. These do not go into the right atrium, just the way it's looking. And behind here, it goes to here. The left ventricle is going to receive the blood from the left atrium and pump it into the aorta. This part up here is the ascending aorta, and then you got this arch called the aortic arch, and there's 3 branches that come off of the aortic arch. Okay? We'll take a break. All right? I'm going to stay here for the hour. If anyone has any questions about the heart or any questions about endocrinology or hematology, I'll stay here.